Everybody, it's Thursday afternoon, just finishing up a long day in the office of adjusting, talking about x-rays, looking at x-rays, and a lot of the content I get for these videos come from conversations that we're having with patients all day. So I thought I would take a little bit of what I've been talking about a little bit today and discuss it with you guys, because if one person has a question about it, usually there's a lot of people that have a question about it. So we're going to do a little bit of a deep dive into x-rays today. Before we cover x-rays, I want to talk about why x-rays are so important. When I take x-rays, I take a cervical series, which is the neck. I take a thoracic series, which is the mid-back, and a low back series, a lumbar series, which is lumbopelvic. It shows me the low back, it shows me the pelvis, and it allows me to assess all three areas. The reason why this is important, a lot of people, when they look at an x-ray or they look at the spine, we're just naturally, we're thinking of posture, we're thinking of pain, we're thinking of if we have a bulging disc, arthritis. All these terms are used and abused. They're thrown out by the medical doctors, and we use them in a way that we don't even really understand what they mean a lot of times. The most important thing when we look at an x-ray to remember is the most important function of your spine. The most important function of your spine is to protect your nervous system, your central nervous system, your peripheral nervous system. God put the most important tissue in your body, your nervous tissue, your brain, your spinal cord. He surrounded it by hard bone. It's the only organ that's completely surrounded by hard bone, your nervous system. You got your brain surrounded by your skull, and then your spinal cord is surrounded by your spine, hard bone. It's meant to protect that nervous system. What happens is when we don't take care of that spine, it starts to stress that nervous system. That's the whole reason in the first place that we're shooting an x-ray. I want to see the condition of that spine so I know the condition of that nervous system, or where that's forecasted, where that's heading. So to dive in a little bit about x-rays, when I look at an x-ray, the main thing I'm looking for is signs of stress. You've got most people, the majority of people, there's outliers, but the majority of people have 24 movable segments from the very top of their spine to the very bottom of your spine. Your C1 bone, your atlas, sits right up here at the very top, and then you have your sacrum at the very bottom and your pelvis on both sides. Okay? All of these bones, when you move, they should be moving with you. The problem is when these joints become excessively stressed, whether it's due to repetitive activity, I'm bending over a table all day, whether it's things like slips and falls, car accidents, some of the bigger things, these joints, parts of your spine, can become excessively stressed. And when those joints become excessively stressed, they start to break down, they start to adapt. Very similar to if you were to look at my hand, you would see calluses at the top of my hand. You don't know how those calluses got there, you don't know what I did, but you can see that that hand is stressed in those areas. When I look at an x-ray, it's the exact same thing. I'm looking for those signs of stress. I'm looking for those changes where your body's broken down. So many times when we look at an x-ray and we see disc degeneration, we see bone spurs, we see those discs are thinner than they should be, a lot of people want to attribute it to age, and what I will simply politely do is point them to an area above or below where those bones look perfect. And I say these joints, these bones are all the exact same age. Why are some wearing out more than others? And it's just simply because that part of the spine is under more stress than the other parts of the spine. So that's where I come in. When we find stress in the spine, we want to start to take that stress off. Now, typically those areas of stress in the spine are the issues that are causing you pain, because there's tissue changes in those areas as well. The muscles, the ligaments, the tendons, all those areas, they've become stressed, they've become flaccid a lot of times, they're just not moving quite the way that they're supposed to. If you've been with me for any amount of time, I often compare it to when you wear a cast on your arm, that arm's not moving for a long period of time, it becomes atrophied, it becomes stiff, and that's the same thing that happens to your spine in these areas. So what do? Same thing we do with that arm. We start to move it, we start to exercise it, we start to work it out, and the more we start to move it, those tissues get stronger, they get healthier. Your spine can do the exact same thing. So that's why a lot of times when people come in to a chiropractor as a last-ditch effort, they've been to all these other doctors, they've been to maybe an orthopedic doctor, a primary care doctor, and nobody can really put they just say you have arthritis or you have disc degeneration, there's nothing you can do. And nothing could be further from the truth. All you have to do is the exact same physiologically Basically, it's the exact same as that arm. That arm hasn't moved. You move it, it starts to get stronger. It starts to get healthier. Your spine's the same way. If it hasn't moved, we need to start to move it, and the longer we start to move it, it's going to start to get stronger. It's going to get healthier. But remember, more importantly than all the tissues, the musculature, the ligaments, all the tissues around the spine, the most important part of that, even the discs, the most important part of that are the nerves, the spinal cord running through those bones, the peripheral nerves coming off of those bones. Those areas need full nerve flow, and a lot of times when the spine's not moving in that area, the signal going through those areas is inefficient. So if you have a nerve going out to your heart, your lungs, and it's being pressed, it's being compressed, that spine's not moving the right way, that signal's not as strong. Digestive organs, same way. Lower back, a lot of people will come in with issues in their low back, and then we'll start asking them about fertility issues or digestive issues and all these things, and typically there's a correlating issue in those areas as well. If you got degeneration in your neck, most people, when I take an x-ray and see a big old spur coming off of C5, which is that fifth cervical vertebra, typically there's a thyroid issue going on. There's migraine headaches. There's regular headaches. There's sinus issues. All those nerves are going directly out to those areas. Now, one thing that x-rays will show me is they show me a result of a lack of motion. They show a result of a lack of motion. They do not show motion. My job as a chiropractor is to find and correlate that x-ray to where the spine's not moving efficiently. Typically, those two areas correlate perfectly, but as we get more motion back in the spine, there are limitations of matter. If you have stage 3, stage 4 degeneration in your spine, that means it's been breaking down for a very, very long time. It's never, no matter how well we get it moving, and here's the thing, it can start moving better. If there's a disc space in there, it can start moving better, but the result, the way that joint looks on an x-ray isn't going to change because you have hard bone changes in that area. Does that make sense? So you have limitations of matter, and that's just something we work around. I've got people that come in, they've got a ton of degeneration in these areas, and a lot of times they respond very, very quickly as far as pain, as far as symptoms go. But if we were to shoot an x-ray that next day, even though they feel better, that x-ray is not going to change as far as what that looks like because there's been permanent changes because of years and years of wear and tear to those areas. The biggest thing that I can stress when we look at these, and as we look at x-rays and as we assess things by the health of the x-ray, is making sure that we maintain motion in these areas where your body is already prone to stress. If you come in and you get great results under care, we start adjusting you start feeling better, you start functioning better, everything starts going perfect. Even perfect is a good word. Even if everything starts going perfect, a lot of times these parts of your spine are still prone to stress. So when stress rises in your life, whether it's physical stress, whether it's chemical stress, whether it's emotional stress, these are the areas that are going to be more prone to acting up because they have a lower threshold of what they're able to deal with. That's why we stress seeing kids, young people, as much as we can. So before we have these degenerative changes in the spine, we can keep it corrected so that these degenerative processes don't happen and we don't have to deal with limitations of matter down the road. Limitations of matter, again, are those things that happen when the spine's already broken down to a certain degree, and they're things from that they change the set point. They change the set point of your body's ability to handle stress. So I hope this helps. If you have any questions about it, this is a topic where you can post a question, or you can just ask me directly at your appointment. You can email me if you're not a patient. As always, if you need anything, reach out, like to this channel, subscribe to this channel, share this information with whoever could benefit from it. I appreciate you guys. I love you guys. I hope you guys all have a great weekend. Talk to you soon. Bye-bye.